All right. Happy Women's History Month. My name is Anne Cinnamon, and I'm part of the leadership team here at CriticalArc. Absolutely thrilled to be moderating this panel with my esteemed guests. And this webinar will be focused on women's safety in higher education and healthcare settings in the UK. We are going to be hearing from these leading women in these sectors as they share best practices, strategies, and real world experiences to create safer environments, really both on and off campus. The session is going to explore key challenges, proactive solutions, and collaborative approaches that organizations can adopt to enhance safety and support the well-being of women in educational and healthcare spaces. So whether you're a university leader, a healthcare professional, or a student advocate, this discussion will equip you with valuable insights from peers facing similar challenges. Before we really kick things off, there is a Q&A. Please enter those in throughout the session. We'll be keeping an eye on that, and time permitting, we will definitely get to those at the end of this. So let's hop in. We are going to start with a round of introductions. And so please share your name, your role, and talk a little bit about the organization you support, managing and running. Sophie, let's start with you.
Hi, afternoon all. Thank you very much for having me. I'm Sophie Bimson. I am the Crime Prevention and Personal Safety Manager at UCL, University College London. My background is basically I started in the police, so I did 6 years as a police officer in trainee DC. And then I've had a number of roles in gender-based violence and VAUG, both in the civil service and also in local authority as well, which led me to where I am now. And yeah, basically my role at UCL is to basically support any students or staff who have any sort of personal safety concerns. And we do a lot of personal safety planning. So this is obviously an area that's really, that I'm really, really passionate about.
Wonderful, thank you. Alyssa.
Hi everyone, thanks very much for having me here today. My name's Alyssa Storer, and I'm a Business Resilience Manager at Durham University. So just a bit of background information about Durham. Durham is the third oldest university in the UK. We have around 22,000 students and around 4,000 staff. Actually, sorry, that's not true. It's the third oldest university in England. Scotland have a number of older universities. I take that back. We're a collegiate university, so each of our students is a member of one of our 17 colleges. Each of our students tend to be residential and live on campus in the first year, and sometimes the third year as well. And for the rest of the time of their studies, they live in the city centre. So we're a city university. We're very open. We have hundreds of buildings that are spread across the city centre, in and around the cathedral and the main city streets. And over 80 of our buildings are listed buildings. So it's a bit of a complicated university. And in my role, I work in incident response, resilience and continuity at Durham.
Thank you. Kim.
Hello, everybody. My name's Kim Hudson. I'm the head of security at University Hospitals of Leicester. The trust is around nearly 20,000 strong in terms of the number of employees that work there. I think it's the second biggest emergency department in England, so quite a significant acute offering. Our three biggest sites, one of which is Leicester Royal Infirmary, right in the middle of Leicester city centre, which is I think it's the most diverse city, is my understanding, in England, so multicultural. Our other two sites, or our main sites, are not too far away as well from the city centre. Again, big estates there. We also then have a number of renal units or community hospitals that also fall within my security portfolio, as well as lots of colleagues working out in the community in residential properties with patients. In terms of my background, similar to Sophie, so I'm from a policing background, 17 years in the police service, finishing as a senior police officer, and my last role was criminal justice lead and investigation sort of improvement lead, directly impacting the VORG portfolio within the police force that I used to work in. So again, same as Sophie, passionate about making improvements in this area.
Thank you all so much. Very impressive backgrounds and current roles. In terms of the first question, actually we'll start with Kim. What are the most pressing safety challenges women face in higher education and healthcare settings today? And how have these challenges evolved over time?
So I don't have any direct experience of working in higher education, but from a healthcare perspective, it is violence and aggression, and I can't imagine that that's too dissimilar, because it's the issue we've all touched on VORG already, that plays out across our communities, unfortunately. I don't know. I'm sorry, Anna. The second part of the question was, how has that evolved over time? Was
Yeah,
it?
over time, how have
Yeah.
you seen that change? And yeah.
I think it's difficult, particularly so because of the underreporting that takes place. So, if I look specifically at my role now within the healthcare setting, we're definitely seeing an increase in the number of reports of violence and aggression, whether that's perpetrated against female colleagues or not. But my view on that is probably actually that number of incidents have always taken place. They've just not been reported to us, and I think we see that, don't we, in other areas, whether it's in policing around sexual offences, those offences have always taken place. Fortunately, people just now feel more able to come forward and report them.
Yeah, you're right. Alyssa, I'd love your take on it.
Yeah, so for us, I think a lot of the safety challenges that we face and we deal with are online based recently, and I guess that's how it's evolved over time. We get a lot of students coming to us with online threats, stalking, online harassment. It's really hard when students and staff members now are so reliant on their phones and different means of contact, whether it's social media, email, phone, WhatsApp. There's hundreds of different channels that people can be reached on, and it's really hard to make sure that you're secure and safe across all those areas. So that's one of our main challenges. And it's also a lot of mental health challenges for our students and staff. I think with students, lots of people are going through lots of different things. There's a lot of external factors. We're a global university. We've got students from all over the world, and with that, there's challenges all over the world. So it's hard to put your finger on what everyone is suffering from and what challenges everyone's going through. So it's just really important to have a really strong support network to support everyone through a number of different challenges.
Sophie?
Yeah, I completely echo what Kim and Alyssa have said on this. I'd just say, yeah, that I think something we tend to have sort of reported to us is actually just like the multifaceted nature of a situation. So often, women won't necessarily feel unsafe just on campus. It could be on their commute. It could be in sort of nighttime economy spaces. There can be so many different things. So our focus is, rather than just looking at women's safety on campus, we try to bring it all together quite holistically and do some safety planning so that we can address the sort of safety concerns that they have in every part of their lives, and really bring that together and make sure that actually, even if if they're feeling unsafe, that perhaps we can actually do a lot to improve their actual safety, because I think feeling safe and being safe are two very different things. So we try to approach it quite holistically and make sure that we are sort of looking at every part of their life, and giving some useful sort of practical tips. One thing I would say that comes up time and time again as well is lone working. So we often have some really major concerns about from women within our community about lone working. I think that comes up in a that will probably come up again later, but that does seem to be something that is quite a challenge for us to ensure that women feel safe when they're working either alone late at night or in different environments that may mean that they're working with hazardous materials and things like that. So there's quite a lot there.
Okay, and actually, I'm going to stay with you for the next question because it's a good kind of transition. Can you share examples of successful strategies or programs that have effectively improved women's safety in your institutions, and kind of what lessons were learned?
Yeah, absolutely. So I believe that engagement is really key to understanding how our community feels about their safety. So two things that we have tried and put into place and sort of piloted is basically we created a group of student safety champions who assist with peer-to-peer engagement. And basically they've come up with campaigns and some ideas, listening to their community and sort of utilizing kind of their own feelings of safety. And they've really helped us with that two-way communication to find out how safe the community feels and then to basically start some projects to address some of those issues. Off the back of that, we piloted a UCL and Met Police joint initiative called Walk and Talks. So basically, anyone can go on a walk and talk in their area of London, but we did a collaboration. So we were offering our students a chance to walk around UCL and the periphery of UCL with a police officer and a member of my team to establish what their safety concerns are. And then we would make a plan to demonstrate that we've heard what they've said and that we're taking action. Something we've learned out of that is that it can obviously be really demoralizing to raise an issue and then not have any action taken. So we've made it very clear when we do our walk and talks that where we can take action and where we can't, because we really want to manage those expectations and make sure that it's a really positive engagement opportunity. But we also then have built some partnerships with local council to make sure that if a suggestion or a concern falls outside of our remit, that actually the right people that can affect that change can step in. And then we just continuously update anyone who has come to us and spent their time with us, then gets an update about what action we've taken. So that's been a really sort of positive initiative. And there's been some great lessons that have come out of that for us in terms of that partnership working.
Wonderful. Kim?
Yeah, so echoing a lot of what Sophie just touched on there, but in a slightly different way. So, as part of our sort of violence and aggression strategy, we undertook a communication campaign called the Kindness Campaign. And that campaign has had two elements to it, but essentially it takes colleagues that have been the subject of incidents of violent aggression, puts them up on a poster and shares their story so that we are engaging with colleagues and encouraging their reporting, giving an outcome as what happened to this person, but also it's patient facing so that as they're coming onto our estate, they are not just seeing a uniform, they are seeing that that's someone's mother, daughter, sister. I'll stick with women on this occasion, and starting to really, I suppose, shine a light on what takes place and how they can have a positive impact on the environment that we care for them within. And that's all really part of our strategy to improve reporting that will then allow us to make sure people get in the appropriate responses. I think Sophie touched on there. There's nothing more demoralising, and I'm prior to us putting this in place and some other strategies in place, making a report and highlighting that you've been the subject of whether it's violence and aggression or something else, and then having no response to that.
Yeah. Alyssa, how about in Durham?
Yes, Sophie and Kim have both mentioned campaigns. We talk about our campaign as well. So we have a security campaign that we run every year with the students. Initially, we were we were doing the campaign at the start of the year when students arrived, and it would be introductions to personal safety and personal security. We also ran campaigns alongside that of river safety, because Durham's built around a big meandering river, and cycling safety and other elements of personal safety. Some of the lessons that we learned from that were to not bombard students when they first arrived. It was helpful information to have, but now we drip feed the information all throughout the year. And the channels that we share that as well, it's less likely that students are going to attend a voluntary lecture on personal safety. So it's expanding the different channels that we use to reach students and staff as well. So and now look to use social media posts and posters up in common areas, and working with the Students' Union to make sure that we're up to date with the best ways to reach students, and working with HR and other staff departments to understand not all staff want to be bombarded with emails. So what other routes can we use to make sure that we're getting this education out there? Another kind of strategy that we've implemented is to produce heat maps on reporting data. So whether that's through our security reporting system, whether that's looking at where our safe zone tip reports have come in or safe zone emergency alerts, our report and support tool. We've got lots of different reporting tools that lots of different teams use across the university, and it's really important for us to understand where those areas of concern are and to make sure that they're all linked up and that our response is aligned. So we can see easily that one of the streets or areas in the centre of town is where we're getting a lot of reports, and that's where we need to focus our resource, and that's where we need to focus our security patrols, and just general awareness and improvements to that area. It's really easy to be able to present that further up as well, to say this is a clear problem and this is something that we need resource and support with. So that's been a really helpful tool for us.
Oh, very interesting. Okay, thank you for that. All right, we're going to semi-shift gears in terms of the question. It is, how can universities and healthcare organizations collaborate with policymakers, law enforcement, and community groups to create safer environments for women? Kim, do you want to start?
Yeah, absolutely. So I'll relate this to our emergency department, but clearly it goes across the trust. So um, many of the visitors, patients that perhaps raise concerns from a security or violence and aggression perspective are individuals that have got, someone's already touched on students with complex needs, complex background, and trying to solve that from a purely security perspective just wouldn't be possible. So at UHL, we definitely have a multi-agency approach to whether it's someone that frequently attends, to resolving whatever issues that individual is bringing, so that they don't frequently attend our emergency departments, don't have that impact on our resource, that they're getting the best care and treatment within the community, and not coming through our doors, whether that's related to drug addiction, alcohol addiction, homelessness is a significant issue that we see within our emergency department and in and around our estate. So yeah, absolutely, that multi-agency approach, and getting the right people around the table, both from an individual perspective and that wider policy piece, is something that we definitely do at UHL.
Sophie?
Yeah, I think echoes a lot of what we're doing as well. I'd just say, I think we're incredibly fortunate at UCL. We have a Metropolitan Police officer who is a university liaison officer, and he helps us a lot. Basically he'll come to some of our safety seminars. He comes to a lot of events. He's very much a presence on campus without being an unwanted presence, if you like, because obviously that, historically, there have been some sort of cops off campus type campaigns, but actually it's a really positive collaboration. currently we are looking to formalise an information sharing agreement, which I think will really assist us with more effective two-way communication when it comes to like really high risk, time pressured situations. But in general, we just try to do as much as we can with community groups, and we try to integrate what is going on in our community and kind of bring that in. So an example of that would be that about a month ago, our local council had a women's safety event where they invited stakeholders from throughout the community, and we got together and had roundtable discussions about positive solutions that would assist everyone, all the stakeholders there, and to create a safer environment for women. And I think just those opportunities, I think we just try to take them whenever we possibly can. So we get involved in, police steering groups, multi-agency case conferences, associations, whatever's on offer, because we know we're not going to tackle this. We can't tackle this on our own. It needs to be a collaboration. So that's very much our kind of ethos at UCL.
And how about you, Alyssa?
We do a lot of work with community groups, both on and off campus, to help improve safety. So on campus, we have a lot of staff networks and student networks that are really helpful for us in highlighting issues and concerns. We have a Women at DU network. We have a Mothers and Mothers to Be network. Those networks collaborate and work quite closely with a lot of other community groups and networks within the university. So they do joint events with our BAME network or with our LGBTQ networks. And a lot of the issues and challenges that are faced by women are also faced by other networks and minority groups. So the collaboration of those groups together is really helpful for us to attend and learn from as they share ideas. And it's a safe space for collaboration that we can really get a lot of information from and a lot of ideas for improvement. I work in the resilience team, so external to campus, we do a lot of work with the community resilience teams and the local resilience forum. So we've got students that live on campus, but we also have a lot of students that live off campus in the city centre. So we encourage a lot of collaboration and work with the community resilience teams. So students and staff that live in the local area are aware of their personal security, things that they can do to improve their community, things that they can do to help them be prepared, emergency preparedness and things like that. But that's another network that staff and students alike can rely on.
All right, I'm going to go to the next question. I'm going to stay with you, actually, Alyssa. And it's something that I think all of us can relate to. What role does leadership play in fostering a culture of safety and inclusivity? And how can institutions ensure that safety initiatives are sustained over the long term?
So it's really important that leadership has buy-in and support of all of our safety and security strategies. It's sometimes difficult in universities to get buy-in from different areas, particularly when we're dealing with academics who are trained to question everything over and over again. And that's what academics do. And it's more worrying often when academics stop questioning things. That's when you know that the interest's gone altogether. So yeah, it's a lot of work with leadership. We have to do a lot of work in advance of before we present things. We have to envisage and prepare for the challenges and the questions that are gonna come with that. So we have to have really good working relationships with everyone in leadership. It's really important that safety and security is an agenda point on most meetings and groups and discussions. It needs to be something that's really introduced and led from the top down and from the bottom up. The resource that we need from leadership. So we need financial resource, we need support for continuous training. We also need support and resource for physical security measures and improvements. So we need funding and budget for CCTV and lighting improvements and all sorts on campus. And it's a difficult time for universities at the moment to get funding and to get any budget approved. So having that working relationship with leadership is really important so that they have a really strong understanding of how important it is.
Sophie?
Yeah, I completely agree with that. And yeah, I think absolutely imperative. It feels like women's safety is getting a lot of sort of focus at the moment. I think probably with the Office of Students E6 condition, there's going to be a lot coming in that is mandated, which is bringing that focus, which I think is fantastic. What I am seeing is that there's a lot of recruitment of ISVAs, so independent sexual violence advisors, into universities, which I think is a really excellent skill set to offer. However, I do think that senior leadership really need to invest their time in understanding what they do, what they can offer, and ensure their roles and remits are really clear, and that those doing this work have access to the resources they need to be effective. I think it's quite easy to sort of pay lip service and employ sort of specialists into these roles, but I think leadership really need to understand the issues that women face and take an active role in promoting the work being done, whilst also taking a robust approach to tackling misogyny in the workplace and ensuring the culture reflects the same principles that the service they provide is offering our communities. It's really down to leadership to set the tone, and they are responsible to their team as well as to the wider community for instilling that safe working environment and really championing preventative initiatives so that they continue to be effective and sustainable over time.
And Kim?
Yeah, so I'd echo all of that, and I think what's been really helpful is that there seems to be a shift in the narrative and more of an understanding from leaders that this isn't this isn't something that should be looked at in isolation. Actually, it's around that holistic approach, well-being approach. Safety and security are integral to all of that. And when we look at UHL, I think it's around 70% of our colleagues are women. So if you want to retain and recruit the workforce, you need to get this part of it right, because they'll go to another employer who is getting it right. So if you break it down to sort of some of that, I think you start to get execs attention when you start talking recruitment, retention, the financial impact of losing staff because we're not getting this right. Then I think you're able to shift the narrative a little bit, as well as, of course, they are committed to it being the right thing for us to be doing, but these sometimes are helpful. And then I'd also touch on the legislative requirements of organisations. So whether that's health and safety legislation, we've got Martin's Law coming over the horizon. I very much welcome that, and how that will support me furthering this agenda with execs and leaders. I think there's several ways that you can approach it with colleagues, leaders, but yeah, I'm very lucky at UHL that we have that support and that buy-in.
Yeah, very smart to kind of tie it to the metrics that they're looking at and match with those goals. So that's smart. All right. Next question, Sophie, we'll start with you. All right, for individuals, whether students, faculty, or healthcare workers, what practical steps can they take to advocate for and contribute to a safer environment for women in their institutions?
Yeah, I think, ultimately, I think we can all be active bystanders and show true allyship. And I don't think that being, an active bystander just needs to be, in the moment that you see something. I think it really pertains to advocacy in general. So I'd say, I think there is always a role for us if we feel comfortable to report issues that impact women's safety, whether it's either anonymously or, as a third party, whether that's within your institution or outside. I feel that we should all feel, empowered to do that, knowing that we are actively tackling a societal problem. I'd also say just, getting involved in some of the conversations around that. There's a lot of working groups within UCL that really sort of tackle some of these bigger issues, both for staff and students. And I kind of feel like it's a really good way to get involved. I think if this isn't happening in your area or in your institution, I think, we can all be we all have the opportunity to be fairly proactive in this space and hold an event yourself and invite partners. And I think that kind of work, being a bit innovative and just giving something a go, can spark something really interesting and like some really important work in this space. And that's very much kind of what we try to do at UCL.
Alyssa, how about you?
Yeah, I think a lot of it is about encouraging reporting. We can't do anything about things that we don't know about. So for students, our Students' Union is really important in helping promote key safety messages and helping sharing the information that we have on using and promoting reporting tools. For staff, it's really important that our staff know how to signpost the reporting tools to students and how to use them themselves. The Safe Zone tip reports that we encourage a lot, because staff and students can report things anonymously if it's something that they feel uncomfortable about reporting and taking their name forward to security to report something. It's a couple of clicks on the app and they can report something anonymously, and it's something that we can follow up on. So it's, yeah, a lot of encouraging reporting, and that's reporting incidents, but also issues around campus, like failed street lighting and suspicious activity and dark areas and things like that. Yeah, I think that's the main thing for us.
Kim?
Yeah, so I think I've already touched on our kindness campaign. That's been where colleagues have been brave enough to share their stories. And I'd just say that if people can share their stories, it shapes the responses that we're able to put in place to, we want a service that adapts to the needs of colleagues. I'm one woman, but I don't know how every other woman in the organization might feel, what service they might want the service to look like. So yeah, if people can be brave enough to share their stories with us, to help shape that, whether that's through, we have a women's network now, or anonymous reporting, whichever way it might be that people feel comfortable to do that. Yeah, absolutely. I would agree with Alyssa and Sophie there. Really, really important.
Love that. All right, next question. What effective strategies have you observed in collaborations between affiliated universities and healthcare organizations that have successfully enhanced safety for women and fostered a culture of safety for everyone? And if you have any kind of specific programs or initiatives that you've been able to make a measurable impact on, we welcome that too. Kim, can I start with you?
You can. I'm not sure what I'm really going to be able to add to this one, and we're we're in the infancy of partnering with our university from a safety and security perspective. I don't have any specific stories of that, but absolutely, when colleagues, we're very close together from a geographical perspective, so we're able to leverage technology in terms of safe zone, so that when people are moving between, where they're students coming onto UHL sites, or colleagues going into the university, we're absolutely to be able to provide that seamless safety and security response to them. So that's really, really important. And I suppose it's just built on what we have within our trust itself, so that people don't want to have to be thinking about, right, where am I now? Shall I swap to this? Shall I swap to that? They have that seamless reassurance that they will get a response whichever site they are on. So yeah, it's in its infancy, but yeah, we've definitely made that move quite recently.
Interesting. Sophie?
Yeah, I think, we are, because of the nature of our landscape, our research, we have very good partnerships with sort of local hospitals and institutes. And I think, yeah, exactly kind of what Kim's just referred to. We try to make that service level agreement really consistent, so that every student, every member of staff that uses Safe Zone can expect the same level of service, whether they're on main campus or whether they're at UCLH, wherever they are, they can expect that same level of security response. So we work really hard at making sure those partnerships are kept intact, that the training is consistent. But I think it's a really fantastic offer to be able to say to our community, this, you can have this here, but you can also, we are part of an alliance, so any other university that they go to, they can expect that same level of service, and we treat that really seriously and have productive conversations with other universities about that kind of response too. So I think there's a really nice kind of holistic approach to that that we're trying to adopt. I'm sure it's the same for Alyssa.
We don't actually have a medical school within our university, so we don't have a medical school or pharmaceuticals or anything like that. So we don't have that alliance or collaboration with any NHS trust or hospital. So I'm probably not qualified to answer this question, but we are working towards joining the alliance so that we do have that shared response with other universities. Hopefully, a lot of our students go to Newcastle to party, to be honest, because Durham's only a few small streets, but a lot of the time we'll go to study. Newcastle and other universities. I just gave Newcastle as an example because it's so close to us, so we're really hopeful that we can join the alliance soon, so that we know that staff and students that go to study in Newcastle or other universities, or anyone that visits us, we can provide that same service. I know that doesn't really answer the question about working with healthcare organisations, but
you're good. It's been interesting just to kind of learn how there does seem to be a trend of more of those partnerships and shared services and shared or consistent experiences kind of throughout a multi-campus organization. So just thought we'd ask. All right. So and actually, Alyssa, you again set up a very good segue for the next question. So as universities increasingly transition to 24/7 campuses to accommodate students' needs for flexible access to services, how have you all adapted, I guess, safety strategies to protect the community, particularly women, during late night and kind of off hours?
yeah, we've worked on a few initiatives with the council and within the university to promote safety at night, particularly for women, but for all students really. We have produced a lit route map, which we promote to students alongside the council. So it's clear to students which routes are the safest routes to walk home from the library. We've got kind of 17 colleges across the city of Durham, so it's always a bit of a bustling, the main streets are busy and lit, but the way that Durham's built, there's a lot of alleyways, there's a lot of little nooks and crannies between old buildings. So it's just making sure that students know which routes to take home, so that there's a really helpful interactive map that we share with students. And we also really sadly have this strategy is no longer in place because we have had to remove the budget for it, sadly. Not we, the university, not our team, but we did have a night cab system for students. So students that were out in Durham that live slightly further out, we could provide cheaper taxis home, and that was registered taxis that we knew were legitimate, and it was a safer and more secure way for students to get back home after a night out. So hopefully we'll be able to reintroduce that soon. But in terms of late night on campus, I think just a general back to basics is just having presence on campus. So security officers on site, our security work 24/7, but when they're working throughout the night, they're not necessarily just in the office. They're always out and about, visible presence, speaking to students. We're lucky that we have got 17 colleges, and each of those colleges will have not necessarily security staff, but general service assistants who work in the colleges. And although they're not security, they are still kind of eyes and ears. They can see, report suspicious things going on. But it's just a friendly face that students know and are used to the GSAs that work in their colleges. And it's a reassuring presence that we have across campus all through the night and through the day. And sorry, I'm just thinking of more things. 24 hours, we do also have an incident response process. So I work in kind of the incident response and emergency management side of things, and the university knows and is assured that if anything were to escalate or if there are any incidents out of hours, there are always people on call that can respond. So we have security on the ground, but if there's anything more complicated, there's a whole escalation process. So we can get the right people in the right place at the right time 24/7, no matter what time of the year or day it is. We can be on campus with comms, with representatives from our departments, whether that's chemistry, something's gone wrong in the chemistry department or something's gone wrong in the physics department. We have welfare that can be on site within a really short period of time. So just because it's out of hours, it doesn't mean that the university business stops. And if that support's needed, that support's always there.
Amazing. Kim, I'd love to hear your take on that.
Yeah, so some of it's similar. So some of the practical elements that Alyssa touched on there. So where they're on certain sites after a certain time in the day, people that don't usually have access to car parks that are closer to buildings can move into those car parks, and at weekends as well. Making sure it's well lit, covered by CCTV, all of those elements. But and it was interesting when Alyssa touched on the black cab. I can't remember what you called it, Alyssa, but we used to have a chaperone service where we would, at one of our sites, walk people from buildings to car parks, and actually safe zones allowed us to transform the way we support people, whether it's checking in and checking out whilst they're on their walk to car parks, and actually being able to provide that equity of service to colleagues across our sites, because that only applied at our city centre site. Colleagues at the other two sites didn't have access to that level of support. So yeah, safe zone's been really important to us, in being able to provide everybody access to that support 24 hours a day, with that on-site security response to respond to them, and put whatever needs to be put in place as a consequence. So yeah.
Sophie?
Yeah, I think a lot of the practical elements of that sort of remain the same for us. I think we've, as part of a security transformation a couple of years ago, we very much kind of moved from static security, although we do have some points which will always remain static, to more basically like community-led sort of hotspot policing style of sort of patrols. So we utilize data, we try to work out where incidents tend to happen, and then we will really sort of focus in and provide as much reassurance in those areas as we can. So it's, high visibility patrols. We also have a system now, because we tend to experience a lot of sort of safety issues in residences. We are providing more staff, both in patrols and static, in those locations, because we know there's a higher sort of level of vulnerability there, in terms of students both being locked out and they're intoxicated, might not have their key, and may not be able to reach other students that are inside. So we will obviously get to them as a priority and make sure they're in safely. And safe zone's a great thing for that, for us to be notified of those types of incidents. So there's a number of different things, and I think, yeah, just as always, it's collaboration as well, because there's some great work going on by the council locally. For example, there's a nighttime sort of a night safety bus where basically anyone can go, they can charge their phone, get water, they can arrange them transport home, things like that. And there's also an emergence of safe havens at the moment, which is an excellent piece of work happening by the Safer Business Network. And we're looking to try and make sure that information is all readily available for our community, so that if anyone needs help, it's obviously, we are there to support them, but there's also going to be other support available depending on their location as well. So yeah, that's kind of like a bit of a flavor of what we do.
Wow. Thank you all for that. Okay, so we've touched on kind of budget challenges and, doing more with less and all of that. So I think this is our last kind of formal question, but how can we leverage technology? And we've touched on some of it, but how can we leverage technology to enhance women's safety in both public and private spaces? and what innovative tools or systems have proven most effective, and how can institutions integrate them into kind of broader safety strategies overall? Alyssa, I'll start with you.
Yeah, so I think safety and security tools need to adapt with the times, and they need to be suitable to the user. So Safe Zone is obviously on a mobile phone, and that's really helpful for our staff and students, because who isn't on their mobile phone 24/7? Younger people in particular, I think, are less likely to want to speak to someone on the phone. They're much more text-based, so having the ability to speak with security and two-way messaging for our students is a huge bonus. It means that they don't actually need to pick up the phone and report something. So in terms of just general confidence and comfort for them, that's a really helpful tool. And it's not just that, it's if you do believe that there's a threat nearby, if you're reporting something suspicious, or if you're reporting someone, you're not going to want to be seen to pick up the phone and speak on the phone. It's going to put yourself in more danger. So it's really helpful to have security tools that are adaptable like that. In terms of broader safety strategies, we look to promote safety and security on campus and in Durham, but also globally. So using Safe Zone to support safety and security and international travel is really helpful for us, especially for women maybe traveling alone or students traveling to higher risk areas, knowing that we have that means of contact and knowing that we can ask that user to check in if anything were to happen in that country, and knowing that we can open up that line of communication really quickly and easily is a really important safety strategy for us.
Sophie?
Yeah, I think so much of that sort of echoes what we're doing as well. And yeah, certainly, I think for us with Safe Zone, we're promoting it on campus, but we're also saying, please do use it everywhere. So yes, we've got contracts with students who need to download it to be able to go for research projects and things as part of their kind of wider contracts with the department. It's something that it's mandated basically by that department. Doesn't come from us. We say whoever wants it can have it, and whoever doesn't want it doesn't have to have it. But that is something that they have arranged between them. And actually, that's been proving really positive. And we have had some activations abroad, and been able to effectively triage those. So I think that's really fantastic. I think in a wider context, we just say to our community, if you ever need us 24/7, press the button, and it doesn't matter where you are in London. We'd rather respond to you and make sure that we can either get you help from the emergency services, and obviously having their location in that moment is priceless, because some of our students, particularly new students, don't know where they are. They won't know what road they're on or how to describe to police where they are. And with language barriers as well, that can become a really a very, very vulnerable situation for them to be in. So we can really take that pressure off and triage it for them and make sure they're getting that help and support. So I think that's been proving a really massive selling point for us. And something that's been really, really positive. And I'd also just say, just going back to a previous question as well, our provost actually has Safe Zone and regularly talks about it. And I think him modelling that really good safety practice is, it's a really nice demonstration of some great sort of top-down leadership, promoting women's safety and promoting how it can be used. So that's been really beneficial as well. And we've definitely seen a lot of take up since that sort of positive messaging has been happening as well.
Yeah.
So when I think about women specifically and what Safe Zone allows, I think women sadly are usually the ones that are the subject for domestic abuse, honour-based violence, and what Safe Zone allows when there is to instantly share that additional risk that they might be subject to, and provide direction and instruction to security colleagues as to how to best support them. So I think, and then Similarly, I think there's potential, and I've got ambitions for that collaboration with policing colleagues, because there's nothing to prevent them having accounts that, should we be the subject of a major incident, whether that's terrorism or otherwise, actually at their fingertips, they can understand where colleagues are. When we look to Martin's Law and what's on the horizon, the mass communications piece. So I think I'm just at the beginning of working out how Safe Zone can support that wider strategic planning that we'll need to do around some of that.
Okay, that's exciting. All right, we have a couple of questions that have come in, and I am going to, I think we have time for one or two. Okay, so this is from someone. Do any of your institutions have any schemes/policies in place to highlight what services are available to any of your female students/staff, or students in general, who have unfortunately been victims of violence/sexual violence? My experience is that universities often don't want to admit that these crimes occur, and as such don't have anything in place to highlight the support after a serious incident/event. Sophie, do you want to tackle that one?
Yeah, happy to jump in there. I think I think we all need to admit that, this is a societal problem, and it is a problem for all of our institutions, unfortunately. I think what we have in place currently is, so we also, like Alyssa at Durham, we also have report and support, and as part of that, so that's basically a platform where you can report either anonymously or with your details for someone to reach out to you and contact you. So when that contact is made, then obviously offers of signposting can be put in place. But we've also got a place on our web pages specifically, and we've got thematic sort of sections to say, if you're a victim of sexual violence, these are a list of support agencies. If you're a victim of bullying or harassment or a different type of crime, there's basically different associated specialist support agencies. We do have contracts with a couple of them. So we have a contract with Rape Crisis. So we can also put in, more detailed referrals directly to them, and sort of just aid that kind of pathway to them as well. But I think it's really, really important that we share that information, and we don't sort of hide away and say, oh, it's not a problem, because it is. And I think there's so many people trying to affect change in this space, and I think that's really great. But we have to admit in the first place that this is not where we want to be, and that there's still a lot to do. But yeah, so
Yeah. Alyssa or Kim, have anything else to add on that?
Yeah, so at UHL, we've adopted the Sexual Safety Charter, and alongside that, a number of strategies, including a comms campaign called We Say No. So that, posters that have gone on all of our staff facing areas, to highlight that actually, as an organisation, we absolutely do not support whether it's sexual harassment, sexual assault. And alongside that, and I've been part of some of this, we are undertaking education training where we directly discuss some of these issues in our higher risk areas. So whether that's among junior colleagues or junior doctors being the subject of sexual harassment, that's a higher risk area. Lone workers, we are going out and reaching out to these groups to, I suppose, set the standard, what our expectations are, and alongside that, what support people can access if they are ever, unfortunately, the subject of that. But we are absolutely, we publish figures to show that we know it's taking place, unfortunately, in our organisation.
Alyssa, anything else from you?
A lot of the same as Sophie detailed. So the report and support, which then does provide specific sexual violence and misconduct support. We have a student support hub, which signposts different areas of support. And that, again, there's whole pages dedicated to support for sexual violence and misconduct. We've recently changed our student support structure at Durham. So the student support used to come from the colleges. So each student is allocated or is a member of a college, and there's a really good support structure in place for each of the colleges. But I think we found that some students aren't necessarily engaged with their college as strongly as they might be with their department. So now we have student support structures within departments as well. So if a student is studying finance or geography or whatever their faculty or department is, they have the similar structures within the department. So we have more people across the board that are trained in support and signposting.
Okay. All right, we've gotten a number of other questions. I promise we will follow up separately with answers for them. I think I will just ask one more that came in, and then we can wrap it up. So thank you all. All right, so the question is there any advice about getting security properly positioned within higher education institutions to make sure their concerns and input is possible at these top table discussions? Security can at times feel like a grudge purchase, but it is essential that organizations support them, involve them, and fund them correctly. Anybody want to take that first?
I'm happy to
Great.
answer in that I don't have a magic answer. I think it's a shared frustration across all universities. Security don't necessarily sit on the executive board, so it is just a case of trying to collaborate, trying to push to leadership and all different angles. So rather than just reporting up our chain of command, it's going to the executive head of faculties, going to head of HR, going to everyone that we know that sits on the executive board, and reminding them of the importance of security culture and putting forward security initiatives, not just up one route, but trying a bit of a catch-all, liaising with every single member of the executive if we can. But I don't think, well, I certainly don't have a magic answer.
Yeah.
I think I'll just touch on again what we spoke about earlier. So, and I know Alyssa and Sophie will do this, talking their language, I suppose, exec's language. So whether we're talking recruitment, retention, being able to present the data, within my setting, being able to say actually how many colleagues have been the subject of an incident of violence and aggression, what the likely impact of that might be. You certainly start to get people's attention. Case studies are always very helpful, because I think we'll all know how, I think it was Oldham, wasn't it, where unfortunately the clinical colleague was quite seriously hurt. Was it? I can't remember that, but highlighting these issues that actually, from a healthcare setting in an acute trust, you are never, unfortunately, very far away from something quite significant and serious happening to a colleague or a patient. So being able to display that through data is always helpful.
Sophie, any final comments?
Yeah, I was going to say about the data as well is a really key thing. And I think as well, we carry so much risk as security professionals, that the thing is, there's also a risk with us not being near enough to the top to communicate that risk and to effectively manage it. We're quite lucky. We do have a good line of communication to the top, but it's taken many years and some serious transformation for that to happen, and a change in organizational structure. So I don't think that's a given, and I think it can be quite a punishing world being in security, because if you do something right, that's great, and everyone, people are quite quick to forget, and if you do something wrong, it's the end of the world. So we're always very mindful of that, and I think that means that we have to work really, really hard to keep up standards. But I think, I guess my advice would just be to keep trying, keep building relationships, keep communicating the risk. And then if that's not properly resourced and if you're not listened to, then the only people that are going to end up, you're not going to be the one that ends up in trouble with that. And actually at some point they have to really take that seriously. So yeah, that would just be my take on that. But yeah, definitely no magic wand for that one.
Could not have said that better. All right, so we are at the hour, actually a minute over. I want to thank you all for joining on the panel. It was really interesting. I learned a lot personally. Thank you to the audience for joining and for being so engaged, asking so many questions. We'll be sending this out for anybody who missed it, or if you just want to watch it again. And let's all work together to build safer, more inclusive environments for women and really everyone. So with that, have a great rest of your day, and thank you again.
Thanks so much.
Great. Thank you.